I'll be talking about an interesting case today. Here is a patient who is 30-year-old. She's married for 5 years. She's been trying for pregnancy for the last 4.5 years. She consulted me because she was having irregular period. So initially on examination, it was more like polycystic ovarian disease. So I started her with medications to induce the ovulation. During the course of the follicular scans, I noticed that she was not responding to the usual dose of medication, both the hormonal injections as well as the oral tablets. That is when I decided to test her for FSH receptor resistance. So she turned out to be positive for FSH receptor resistance. This is a condition wherein you have adequate amount of hormones in your body, but the receptors on the ovaries on which these hormones have to act show resistance. That means they do not respond. So in such patients, you have to use very high dose of injections or medications to induce the ovulation. So the downside of it is you end up producing too many eggs, something like 10, 15 or 20 of them. So that's the reason for this patient, I counseled her for IVF and we went ahead with an IVF cycle. So I had to use a higher dose of medication for her. We ended up retrieving about 12 eggs and we froze about 6 embryos for her. She underwent frozen embryo transfer wherein we transferred 2 blastocysts. She conceived, but unfortunately she ended up with a miscarriage. After 3 months gap, I transferred her with another set of 2 embryos and this time she conceived twins and she is doing well with both the twins crossing 12 weeks of pregnancy. So this is a very rare condition in which there is always a hope for parents when we use the higher dose of medication, and such patients may usually have to consider IVF.